Hello, and welcome everyone to the National Council of Urban Indian Health's Peer-to-Peer Solutions Center, using evaluation data to drive social determinants of health program improvement strategies. My name is Micah Grant-Hunthrup, and I'm one of NCUI's Public Health Project Coordinators, and I will be your host today, taking over for Tiffany Stark. We would like to thank you for volunteering your time today to participate in today's discussion. We at NCUI appreciate your willingness to share your UIO's experiences with health information technology and EHRs. We do understand that this can be a sensitive yet very important topic, specifically during a pandemic. This is a safe place, and feel free to share as much as you feel comfortable sharing. There are no right or wrong answers, and we know everyone is in a different place in regards to their capacity and HIT and EHR experience. This is a chance for everyone to learn from each other. So again, welcome. We are very pleased that you could join us today. Your feedback is very important to us and will allow us to further understand your HIT and EHR needs and how to support them. If you do have any IT difficulty during today's call, please chat directly to Comms and Events, and Lamar can further assist you. Finally, if you could, please enter your name, UIO or external organization, and any tribal affiliations into the chat box so we can get to know each other and count your attendance. So thank you. Before we begin, we do want to review a few quick housekeeping items. Please, if you have video capability, feel free to enable your camera, as this helps us create a more interactive environment. Also, please note that your microphones are muted, but you will have an opportunity during our listening session to answer questions. You can raise your hand at the bottom if you'd like to be called on, or just on mute if there's silence and pop in. Our chat box is being monitored as well, so feel free to drop any questions or comments throughout the presentation, and we will address them at the designated time. Please note that this session is being recorded for educational and quality improvement purposes. Your answers will not be published, and the information you provide will be used to better support our UIO. Here we have our evaluation link reminder, as well as a QR code that you can scan. We do really value your feedback and would really love if after this event, if you could take our evaluation and let us know how we're doing so that we can make these events better for you. I'd like to acknowledge that this project is supported by the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services, HHS, as part of a financial assistance award totaling $100,000 with 100% funded by CDC HHS. The contents are those of the authors and do not necessarily represent the official views of, nor an endorsement by CDC, HHS, or the U.S. government. And now we'd like to provide a little bit of background about NCUI. Our organization is a national nonprofit devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. We represent the 41 Title V UIOs under IHS in the Indian Healthcare Improvement Act. We strive to improve the health of over 70% of the AIAN population that lives in the urban areas, supported by quality, accessible healthcare centers. That's as to our agenda, and so far we've gone through our welcome. We'll do our introductions, have our presentation by Jane, SME Jim Spillane, and then an open discussion. James Spillane is joining us as NCUI's Health Information Technology subject matter expert. James is the CEO of Health IQ. He has extensive knowledge in HIT and EHRs. He has served on several national committees, such as the OIT Information Systems Advisory Committee and faculty for the IHS IPC/QILN Collaborative. At this time, I would like to hand the presentation over to James. Thank you so much, James.
Of course, this is great. This is kind of where I was just saying earlier, this is kind of where it starts getting fun. It's kind of really the first time we really start to dip outside of the organization doors, right? So we're going to kind of put it all together now and look at what it looks like at the community level. And so this is really an exciting, because I get to talk about best practices that I see all over the country, whether it's at San Carlos Apache, Navajo, Montana, or, all these places that I get to travel, I see a lot of really cool things, and I see a lot of community outreach going on, and it's just getting better and better and stronger and stronger. And that's what we're going to talk about today. So we've talked about policies, we've talked about healthcare design and designing your care teams. We've talked about reports and quality reports. And now we take all these data and we now know what our social, determinants are. So now we kind of put it all together and say, all right, what does this whole entire thing look like? All right, next slide. So right off the bat, social determinants of health. So it's kind of funny because there's like a pie chart somewhere that I saw once that said, here's how much a doctor and a healthcare team affect the patient's health. And it was like a slice. It was like 5 to 10% is all they can do in changing the outcome of your life. All these other things in your life really play a role. Your family, the people you surround yourself, your friends, all these other things, your environment, all really affects your health. So now we're going to kind of deal with the other 90% of the pie. So we've been kind of talking about that 10% of the pie. How do we maximize and do really good at that? Now we're going to talk basically about the other 90%. So here they are. So all this stuff, if you go to health.gov, it's all on there. So this is basically everything you're going to see here is pulling from Healthy People 2030. So how we had Healthy People 2020. Well, now it's Healthy People 2030. And so this is kind of the areas that we're going to focus on today. Healthcare access, neighborhood and environment, social and community, economic stability, education, access, and quality. Okay, next slide. So remember this slide that I showed you before? This is now why we're really getting into it now. And this is a really good one because this kind of shows you at the community level, all the things that we can be doing. So again, we're now thinking outside the box, outside the building, if you will. And so what do we got? What can we offer? What food programs can we offer? What classes can we offer? What training services can we provide? So it's kind of like us getting outside of our healthcare box and kind of getting more into our teacher box and stuff like that. And that's what I really love about this presentation. And this is what I really love about the slide deck, because right here in this individual picture, you're starting to see things that, other people are doing where, oh yeah, we're going to try and do this program. We're going to try and do that program. So they're kind of evolving outside of their healthcare organization and starting to look at things like, well, how do people get around? How do people get to this grocery store? Stuff like that. Can we play a role in that? Can we provide transportation for people to get access to food and securities like that? Next slide. So we'll start out. So obviously this is an important one. Here, let me move my my little guy here down to the bottom. All right, so this is a really important one, economic stability. So the goal is, and this is just screenshots right off the website, help people earn steady incomes that allow them to meet their health needs. Now, next slide. And this is just kind of like some obviouses, right? In the United States, 1 in 10 people live in poverty, and many people can't afford things like healthy foods, health care, and housing. People with steady employment are less likely to live in poverty and more likely to be healthy, but many people have trouble finding and keeping a job. People with disabilities, injuries, or conditions like arthritis may be especially limited in their ability to work. In addition, many people with steady work still don't earn enough to afford things and that they need to stay healthy. So kind of just going into this, when we look at it this way, it's like, you could go meet a patient every day. Like you could see that patient, and every time you see them, you tell them, hey, you know what, you should probably, change your diet to, more superfoods, get some more spinach, maybe do some smoothies in the morning. We need to get, your cholesterol down and your blood pressure down. But at the end of the day, that's all moot point if that person doesn't even have a job and they don't have work. So what we want to do as organizations is kind of delve into this and ask these questions and find out. Otherwise, we're just wasting everyone's time. So I'll kind of show you some of the things that are actually starting to work, or they're actually making improvements in around the country. Next slide. So What we're seeing, employment programs, career counseling, and high quality child care opportunities can help more people find and keep jobs. In addition, policies to help people pay for food, housing, healthcare, and education can reduce poverty and improve healthcare and well-being. Now, that's not saying that we're going to provide these things, but what we can do is get involved and create relationships and be kind of the, hey, you know where you should go check out, or hey, these guys over here do this program. But if we're not making those connections and we're not doing that research and we're not finding these things out, we're not really helping our patients to the fullest of our ability. Childcare particularly is a massive one. Like when people know that they have a good source of childcare, or they know somebody who knows somebody, that can, oh yeah, Maria does this, or so-and-so does this, and oh, over here we take our kids here. This is really, really good stuff. And if we know of these things, at least knowledge of it, we can actually help and, steer our patients in these directions and get them in these support systems. Next slide. So what we're really seeing improvement on around the country is reduced household food insecurity and hunger, and reduced work-related injuries resulting in missed days of work, right? So what that means is, at the end of the day, we're starting to get better programs that are providing food, whether it's school programs, whether it's healthcare programs, whether it's grow your own programs. And we're going to take a look at some of these and kind of what it looks like in the big picture. And the other thing is stop, don't do dumb stuff at work. Be conscious and be safe. And that's why half of these like OSHA rules exist and all that is because somebody already did it. Somebody already got injured trying to do this or do that. So let's just be smarter about what we're doing, and we'll have less of these injuries. So we ourselves can do that, but we can also, work with programs. And, I see programs all around the country, and I'll just be like, hey, what are you guys doing over there in that parking lot? You're at the grocery store. What are you guys doing? Oh, we're checking seatbelts, child seatbelts, and child, what do they put the kids in, the little chairs, right? We're checking those and making sure they're good. These are programs that are being driven by healthcare, and a lot of times in coordination with like education, and that make differences, and it's all kind of resulting in this stuff. All right, next slide. So I'm going to talk a little bit about the Kenichi tribe, and they had probably one of the coolest full community where healthcare played the center role, and it was associated with everything. So it's a part of the education system, it's part of the safety system, it's part of the housing, it's part of the food security. It's all there connected to everything. So they have a really beautiful clinic that's kind of new. They just rebuilt it. That's all repurposed wood from their tribal cannery. We'll show you a little bit of that. And then also, it's supposed to represent fish ladders that we dry our fish on. So that's what you're kind of looking at. And you get the beautiful northern lights, which you don't really see them as much as people think you would see them up here. All right, next slide. So this is a great example of what summer looks like in Kenai. So this is a tribally run and operated. So it's working with the youth. They have programs every single day of the week. You can come and drop your kids off, and they have all these events. It's like camp, right? It's like going to a camp or something like that. And a lot of them are like, hey, we're going to go, this is all about the fisheries, right? So they're going to their set net sites, and the kids, a part of this camp program, are actually pulling up the fish. Then they're learning with elders and learning with the older people in their community. Here's how you cut the fish. Here's how you fillet the fish. Here's how we smoke the fish. We're going to take it to the smokehouse. This is how we hang the fish up. So I don't know if you guys know, salmon is one of the healthiest foods in planet Earth, apparently. So this is great, rich with omega-3s, but this is all going back to the community. So now they're involved in the whole entire process of getting their food naturally and organically. Next slide. And this is really beautiful programs. So, this picture is kind of cool because you see an older gentleman, Steve, is now working with the two kids and he walking them through the whole entire process. That picture with the little gloves you can see really shows you how many people are involved in this. There is their fresh harvested salmon. Again, this is a program. This program, it's amazing. You're dealing with. If you look at it from a little bit farther away, it's childcare, it's education, it's just everything that we strive to be. It's that. That's what this is. All right, next slide. Here they are back at the healthcare center, and they have a full-blown test kitchen. So I've never seen anything like this, but I'm talking like a full-blown kitchen is inside of their health clinic. And it's made to do demonstrations. It's made to say, here's how we process reindeer. Here's how we process salmon. It's made for educational purposes and classes. But again, here are the children that are a part of the program that are going to the camp, and now they're learning how to can, harvest, smoke, dry, everything, the whole process of the salmon, which goes back to the people. Next slide. So here it is. Here's what it looks like. It's getting all canned up. You know what makes this really good? Put a little jalapeno in there, and then let it ferment in there. It's really good. All right, next slide. And then here's an example of winter activities. So here, this is basically they're teaching the kids how to hunt, how to call. This person basically doing a moose call. How do we hunt? How do we lay trap lines and stuff like that? And so they're taking the groups out, they're teaching them all of it, and they go through the whole entire process. So again, it's the cultural aspects of it, it's the elders working with the community, it's education, it's everything, right? But best of all, it's sovereignty. And this is what you're really starting to see, is you're seeing this sovereignty. It's like we can create our own programs and do our own things, and we don't have to be dependent. Let's just do it ourselves. Do it the way we want it done. Next slide. So here they are laying trap lines. So this is like a snare system, if you will. So up here in Alaska, we actually people have trap lines still, and they'll have a snow machine, and they'll go out a 5-mile circle or something like that, and they'll lay trap line, and they'll see if they get anything, and then they go back and they process the animals, and then sometimes they'll sell them for fur. We actually have a big thing called Fur Ronde, where people come in and say, here's all the things we got from that. But again, classes on how do you sew this, how do you sew the furs up, how do you process these animals, how do you go through these processes. And we could say, sure, we live in urban areas, but I mean, I've been to New York City, and you drive 20 minutes north and you're in the boondocks, you're out in the middle of nowhere. We can get out to these places. We do have access to nature. We do have access to this stuff. Next slide. So here they are. This again, the Kinaiti tribe, they're processing the moose. So they got the moose. Now they're teaching the kids, this is what you do. This is how you do it. So this is, again, one with the land. It's getting back to what the basics are. Next slide. Here they are now back at that test kitchen I was telling you about, and they're going through the process of teaching the kids, this is how we quarter a hind leg of a moose. This is how we this is how we retain the meat. Next slide. And then what do? They give it to the elders on Fridays. So you could literally, this is, I believe what they did here is they're at the senior center right now, and they're giving it away. But also every Friday, they give away vegetable boxes, salmon boxes. They give away canned salmon and canned meats and preservatives to the community. So anybody who wants food, they got food. I mean, they basically are living like kings down there because they're eating all this really good, organic, healthy food instead of eating processed foods. And so what you see over a time period is you see all the high blood pressure. You start to see all these health indicators that we follow start to change in a favorable directions and positive directions. Next slide. So now let's take a look at education and access to quality. So the goal of this one is to increase educational opportunities and to help children and adolescents do well in school. Okay, so what does that look like? Let's go to the next slide. So what we do know is people with higher levels of education are more likely to be healthier and live longer. children from low-income families, children with disabilities, and children who routinely experience forms of social discrimination like bullying are more likely to struggle with math and reading. They're also less likely to graduate from high school and go to college. This means they're less likely to get safe, high-paying jobs and more likely to have health problems like heart disease, diabetes, and depression. The stress of living in poverty can also affect the children's brain development, making it harder for them to do well in school. The intentions to help children and adolescents do well in school and help families pay for college can have long-term health benefits. So I was saying before, you're now starting to see comfortable learning situations where people are going and they're actually learning from likewise individuals and elders in their community, basic programs. Next slide. So what we are seeing improvements in, so let's say you make 10 to 15 different initiatives. These are the main ones that we're seeing improvement in across the country. So an increased proportion of students with disabilities attending school. So this is schools becoming more accessible, and that goes for ramps, that goes for, door openings, that goes for drinking fountains, heights, stuff like that. Increased proportion of high school students who graduate in 4 years, and increase the proportion of fourth graders proficient in math. So what I would say is when I see that the tribal healthcare urban, IHS setting is when we create these programs where we're actually outreaching and going into the schools, working with the schools. Like I said, the Comanche tribe, for example, they are completely embedded with the education system. So they have their behavioral health staff work one-on-one with Head Start, go over, do training sessions, do lunch and learn, stuff like that with the school district. And that's how I see Indian Health interacting in these kind of settings. Next slide. So here is, I think you can see at the bottom or something, it says the National Indian Education Association. But this is just kind of like, kind of a hierarchy picture of all the things that they're kind of looking at and all the programs that they have. So building tribal education capacity, wraparound services, post-secondary success, assessments and accountability, skilled educators and leaders, language, culturally based education, and advocacy. The biggest part that we can play a role in is, I think, cultural education. And we look at like language, particularly, and language revitalization and cultural revitalization is the biggest part that we can play. So let's go, and then you kind of see the main entities that we can connect with. So we can connect with tribal education, we can connect at a federal level education, we can create partnership organizations, and then we can also work at the state level. So how do we connect? How do we be a part of it? Whether it's just being a part of a meeting and knowing what's going on and what's being offered so we can translate that and pass that on to our patients and our customer owners. Next slide. So here is Mount Edgecombe, and this is in Sitka, Alaska, and imagine going to school there. Like, how do you even concentrate on school? You're just too busy looking out the window watching the fishing boats go by. Beautiful place though, but this is a completely tribally operated and owned school. So here, I'll just show you. Let's go to the next slide. So they said, you know what, we're going to have our own education system. We are literally going to, anyone can go, but we're going to cater to Native Americans and Alaskans. So this is what you're seeing, and you're seeing that we're going to have our own programs. We're going to have our own track and field. We're going to have our own hockey team. We're going to have our own basketball team. We're going to have our own everything, and we're going to have our own science camp and all that stuff. So this is beautiful, and we actually have this all the way from, we have these programs running up here in Alaska, and they're running actually all over the country, where it's all the way from, like I said, Head Start all the way to the university level. And we're seeing this happen really effectively all over the country. North Dakota has relationships with the university there. So they have, hey, do you want to be a doctor? Hey, do you want to be a nurse? Hey, do you want to be a mid-level? All right, let's go ahead and we'll get you going. We have this relationship with these people. We're partnered up with them. We have here in Alaska, the Alaska Pacific University. It actually has whole entire Native programs, and you're going to see that in a second here. So let's go to the next slide. Here's their graduating class. So again, they're saying, you know what, we're going to sovereignly look at ways that we can handle these education gaps that we have. We're going to address it. We're going to own it, and we're going to see the healthy outcomes of this. Next slide. So Alaska Pacific University. So this is now it's basically Alaska Native Tribal Health Consortium has kind of like taken it over. So I think they were financially kind of running into some problem. They said, hey, we can loan you the money, but here's what we want. We want board members, and we want to run these programs. And now they have these programs up and running at APU. So, and I'm talking like the nursing programs, I'm talking medical assistant programs, doctoral programs, stuff like that. So now they are completely combined, and it's really weird because they're all on the same campus. Like our native health clinics and all of that stuff is really right next to the university. It's all one giant area of just learning. So it's kind of like we're creating these feedback loops and these circuits that like everybody, like everything is right there, and you have, we call it cradle to grave care. We kind of have that with education now up here in Alaska, and I'm seeing it all over the country. So that's a good news. Next slide. So this is the Alaskan Native Science and Engineering Program. So this is a pretty famous program here, but its extent goes all the way across the whole entire Alaskan education system. So this ANSEP actually has roles in high schools and elementaries all over our state. Science programs, you've heard of STEM and stuff like that. This is a Native-run program. And what their goal is to create more Native engineers and scientists. And we're always needing stuff in the state of Alaska. We're always looking for these kind of people. But now we're growing our own, all the way getting the interest perked from the age of kindergarten on up, all the way to you're now an engineer. All right, next slide. And so this is actually the building. It's actually an engineered building. It's great. It's architect, right? It's done and designed by them. The students actually designed this building. You can see the masks. There's 3 masks in that front window. That's the artwork. But that's the ANSEP building on APU's campus. Next slide. So here's kind of what it looks like from the side. And then right here, you can see these programs are all about outreach. It's like, how do we get the kids? How do we get the kindergartner, the first grader, the second grader, the third grader? How do we get them into this? So they have camps all year long. They have programs all year long. They're going out into the schools, doing these things, saying, all right, we're going to have a bridge building competition. All right, we're going to have a who can make a plane competition, the whole drop an egg off of the roof competition, see whose egg can thrive by, and you can only use these materials. They're getting them involved at a young age. And so they're really dealing with these health disparities, and now they're tackling them, and now they're thriving. Next slide. Here they are. I just put this one up here because it looks all engineering. It looks all wicked smart. But yeah, you see these programs, you see the benefit of these programs are basically, we also provide future, not employment, but like future workers for these industries that we really are always looking for people. So before it was, we're reaching outside of what we call the Alaska, we're looking at the lower 48 for these skills. Now we are growing these skills from within. Next slide. So now let's go to healthcare access and quality, right? So the main goal of this is to increase access to comprehensive, high-quality healthcare and services, because at the end of the day, if they can't get in to see your healthcare team, everything else is moot point. Access is the most important thing. Can you get to the things that you need to get to? So we'll take a look at what that looks like. So next slide. So many people in the United States don't get healthcare services they need. Healthy People 2030 focuses on improving health by helping people get timely, high-quality healthcare services, insurance, and primary care providers. So it's just getting empaneled, like this is your provider, this is your provider, this is your provider, stuff like that. And then we look at places like, when we especially look at the rural areas, not the urban areas, but the rural areas, transportation is a major, it's the biggest thing that we deal with. Even like when you look at places like Great Falls, and let's say somebody comes into Great Falls or somebody comes into Missoula, they get healthcare. They're like, oh, you got to go back to your, you got to go back here. How do they get there? How do they get back there? So do we have transportations? Do we have buses going back and forth from here to there to get back to the tribe where they receive this PRC care that they get? Right. Next slide. So reduce the proportion of emergency department visits and wait times. So these are the things that we're seeing progress in. So what I'm showing you is the doables, the actionable items that we're actually seeing progress in. So we are reducing the proportion of emergency department visits and wait times. We increase the access to insurance and access to prescription meds and prescription med insurance. Increased access to dental care. Reduce the proportion of people who can't get a medical care when they need from a primary care provider, and increase patient participation in decision-making and care plans. So this is a lot to kind of swallow, but basically what this is saying is, why don't we assign patients a primary care provider? Why don't we help navigate them? Like, oh, did you know that this, have navigators, have people who are there on staff that can say, oh, we can sign you up for this insurance, or, oh, yeah, let's get you signed up for Medicaid. Let's get you signed up for Medicare. Oh, did you know we have dental care? And making these connections within our own buildings. This is ones that we can actually control a lot of these actions with. So, and yeah, knowing once you have a primary care provider and you've got somebody and that's your person, you're less likely to go into the ED and go be seen. You're more likely to go say, hey, I got this thing, can you help me? Next slide. All right, so what I'm and we've talked about this before, we've talked about advanced access, open access, basically saying, I guess at the end of the day, if a patient shows up to your clinic, do today's work today. Don't turn them away. Say, we'll get you in. We'll figure out how to see you. You might have to wait a little bit, but we'll get you in. Patient-centered medical home model. So this is the big thing. This is what everyone's doing all over the country. But if you say, hey, we want to be accredited as a patient-centered medical home model, whether it's the Joint Commission or whoever, NCQA or whatever, that will take you on the path to deal with a lot of these social determinants that are negative and help close these gaps. It will literally take you on that path. Health literacy is a huge thing. So this is a big question that's actually being asked now, a lot more than it used to be asked. And it's something like, do you ever have difficulty understanding your treatment plan or directions that the provider is giving you, or your medications that you are taking? But it's trying to understand where the patient is and meet the patient halfway. If we're using big fancy words like abscess and edema and stuff like that, I don't know what that means. So what we want to do is make sure we're clearly speaking and the patient understands what the process is. And a lot of it will be like speak back and stuff like that. Native speakers have had huge impacts in healthcare, especially when you look at places like Navajo Nation, Apache, San Carlos Apache, and places like that, where they can go in, elders can go in, and boom, there's the navigator right there speaking their language. That's very impressive because they can walk them through steps like transportation about here's how you go, here's what you'll do. We'll set you up with that. We'll get you a ride. We'll get you taken care of. We'll get the hotel voucher. We'll get the food vouchers for you. That's a high return on reward. And then the other area we've seen a lot is fast track clinics. So that's like taking a part of your clinic and saying like, oh, we got 3 providers, but this provider is just going to deal with the treat and street, like real quick, get you in, we'll get you in, we'll see you, we'll order whatever the med you need, whatever. We're not doing the comprehensive care like the diabetes and stuff like that. We're getting the people seen for little things here and there. Otherwise, they're going to go to ED and it's going to cost the system greatly. Next slide. So here's an example. Here's San Carlos Apache's transportation. They got all sorts of transports. They also have mobile units that go out, so they can do mobile mammograms, they can do all mobile visits, mobile clinics, mobile dentists. They're basically starting to say, all right, how do we get to the people? How do we meet the people halfway? Rather than having to go get them all, which they're doing right here with the public transit, but they're also looking at ways to, like, not only do we bring them here, but also how do we go out? How do we go to the casino? How do we go to this elementary school? How do we go to the wellness center and provide these same services, these outreach services? Next slide. This is Fort Defiance. This is their new wellness center. It's probably the best gym I've seen out of all the 70 places I visited over the last couple of years. Like, this was like, wow, you guys are really taking it to a whole nother level. Like, talk about physical therapy, talk about like all these other programs, rehabilitation, stuff like that. They now have people like, I've been like, can I use the gym? Kind of thing. It's pretty amazing. It's pretty good to see what other folks are doing. Now, that doesn't mean that you have to build a big giant gym. What that means is you create relationships, or you find space that you do have available, and you try to create these programs and grow these programs, because it is vital. It's health. Next slide. Here's an express clinic. I think this was at Crow Agency. And I was like, oh, cool. They got like actual signage. Like, it's like basically steering the patient. And I'm like, yeah, I had one of those things. I'm not going to go over here and try and get in to see my primary care provider. You know, I might be booked out 2 weeks. I just got a sore throat, so I'll go this way and I'll get seen real quick. So what you're doing is providing multiple ways of care, you know, triage and urgency of care. Next slide. Here's the signage that I saw that were up in these places. And so now what you're having is self-selection. You're having the patient make these choices too. They're coming in and they're like, well, I'm not dying. But what am I here for? Am I here for, am I here to manage my blood pressure? Am I here for diabetes? Or I just need some ibuprofen and I have an earache. So what they're doing is they're self-selecting. They're part of the decision process of where they go. It's actually, it's like steering, if you will. Next slide. Here are the navigators this is, I believe, again, San Carlos Apache. And they have navigators. They wear those blazers, really. And as you walk in, these are the people who greet you. And they help you and answer any question that you have. They'll steer you anywhere you need to go in this process. Oh, you're looking for the dental clinic, or oh, you're looking for behavioral health, or oh, the emergency department is over this way. Oh, you speak Apache. Here, I speak Apache too. They basically are greeting you, and they're trying to create more of that customer service relationship with the patient. And so now what you're seeing is the patients are actually feeling comfortable in the healthcare system itself. Next slide. Neighborhood and built environment. So the goal for this one is create neighborhoods and environments that promote health and safety. Let's go to the next slide. So neighborhoods people live in have major health impacts on their well-being. Healthy People 2030 focuses on improving health and safety in places where people are born, live, learn, work, play, worship, and age. Interventions and policy changes at the local, state, and federal level can help reduce these health, safety, and risks and promote health. For example, providing opportunities for people to walk and to bike in their communities, like adding sidewalks and bike lanes, can increase safety and help improve health and quality of life. Next slide. So what they're really seeing high impact areas around the country are in reduced health and environmental risks from hazardous sites. So they're identifying hazardous sites, working as a community to say, let's get this cleaned up, figure out ways to get it cleaned up. We saw a lot during COVID-19 working in FEMA to actually do a lot of this, and getting help from like National Guard or something like that because of these national health emergencies. Cleaning up the sites, increased access to fresh, clean drinking water. So working with state entities and community entities to make sure that we have fresh drinking water. Increased a proportion of homes that have entrances without steps. A lot of what we call this is like fall risk assessments and stuff like that. So we actively go out, whether it's like the public, we team up with public health or something like that, but we actively go out and in our community and look at things like, oh, is this your home safe? How can we make it safe for you? Smoke detectors, just basics like, oh, we're having a drive and we're handing out free smoke detectors. So if you want to come here, we'll give you a smoke detector. And then smoke-free homes, the education programs that basically say, if you do use tobacco, use it outside your home. Next slide. Social community context. So goal to increase social and community support. So I'll try and go through this quickly because there's a lot of slides and I'm almost wrapping it up here. But that last slide, again, walking areas, fun runs, stuff like that. And I'm going to show you what that looks like here. Next slide. So when you really start to think about it and you think of healthcare, they do have roles in all of these events. How do we get ourselves involved and in these events? So top left, this is a rodeo. I believe, I can't remember if this was Montana or I don't remember where this was. But anyways, this is rodeo. So how do you get involved? How do you have presence in this? How do you have decision-making as a part of healthcare in these things? So this is a community. This is healthy communities and what they look like. Over here is a food program at the Kanaiti tribe. So this is at the Kanaiti, Kanaiti's Senior Center. And what they're doing is they're basically having food and having food program, deliver that food at the Senior Center. So you just show up there and you can get some free deals, a meal. Down below is fun runs. Healthcare can organize. It doesn't really cost anything to have a fun run. You just got to get a prize and a couple of bibs, and that's like the cost. You get the water out and all that other stuff. But these are ways to bring healthy communities together, groups of people together, at a culturally appropriate ways, and to have fun. So now it's again outside the box thinking. Like, how do we get out to the community? Next slide. This is Alaskan State. This is our Native Olympics that we have here. So kids like my son they're in their classrooms at school practicing this stuff, seeing who can kick the highest and stuff like that. So this is a huge thing that happens all over the state of Alaska. But again, this is community. These are people like me. We're participating in these events. It's healthy events. You're seeing it kind of all accumulate and come together. Next slide. This also happens with dance groups. This also happens, like we have Kodiak drummers. There's all sorts of stuff. This is the girls, and they make their own regalia. They wear it and they show it off, and they get judged on. All right, who won this competition? Who did well here? So this just is giving you an example of growing and thriving communities, of getting out there and creating these environments where, oh yeah, I fit in here. Next slide. Well, that's it. So I'm pretty much done with my slide deck. That's what this slide means. But I just want to say thank you for listening. And this is when we look at healthcare, this part right here, this is the fun stuff. So let's get more of this stuff going and get more fun and get more outreach and get more connection really at the end of the day, because this is really what it is to be a human. And that's all I have. Thank you very much.
Thank you, James. We appreciate you joining us today and providing us with that wonderful presentation. We really appreciate it. We are now going to transition into our open discussion portion of our session. Just a reminder, here's our evaluation QR code so that you can give us some feedback. But at this time, we would like to open it up to anyone who has any questions or comments for James regarding this presentation. We did have one question earlier. So the first healthcare clinic that you showed, James, was the architecture that looked like the ladders for drying the salmon. Where was that? What was the name of that center and where was that located?
That's Kenai Health Clinic. So that's on the Kenai Peninsula. So that's just south of here, like 3-hour drive. It's funny. It's a 15-minute plane ride. It just goes up and over, but you go all the way around and get there. Man, they're one place that if I was going to say, hey, you have some money and you can buy a plane ticket, go visit these guys and see what they're doing. They're amazing. And that's just that's where all that salmon stuff was going down too, and the moose hunting and all that stuff. They also have greenhouses and grow your own programs where the kids, like I said, the kids have their own raised beds and they're going over as a class or walking over to these greenhouses and growing this stuff. And then later, like I said, on Fridays, they give out whole boxes of like arugula, Swiss chard, spinach. It's like, so yeah, imagine what happens over a decade of everybody eating like that, how you'll see the blood pressure go down and the over time. And that's let alone all their fun run events and stuff like that they have.
Yeah. Thank you. That does sound really fun, and I would love to go visit.
Yeah, it's worth it, and it's gorgeous there.
For our group, feel free to add any questions or comments into the chat box or come off of mute, whichever you are more comfortable with. Our chat box is monitored and we can guide for those to unmute at the appropriate time.
Yeah, it really does. It really does seem like the places that have the they start venturing down the greenhouse route and down that route. That those seem to have like the biggest paybacks, because I think, like, what are they called? USDS or whatever, United States Department of Agriculture, right? USDA, right? They have whole entire programs where they're like, if you can sign up and you can justify it, we'll build and give you the greenhouse. And so a lot of tribes are taking advantage of that, and they're saying, yeah, we want that. We want this program. And then they'll give them a couple of greenhouses, and then all they have to do, really, I think the stipulation is give back to the community. So whatever you grow, give it back to the community.
Community gardens are another thing that I've seen, at least in my area, that have been really helpful as well.
Yeah, totally. Our church just did one, and they got like 60 beds, and we're like, there's no way we're gonna fill this out. And now there's like a waiting list. I'm like, people are like, oh, dude, free bed. All right, I'll take one. So it's actually amazing. It's just like, yeah, we need to all get back to like growing our own food, gardening and stuff like that.
Well, we can move on to the next slide while everyone thinks of any questions they might have. So just a reminder that if you would like a one-on-one session with James or have any other technical assistance requests, you can fill out this form on our website. It's nacooee.org/TA, and we can help you out with anything that you or your UIO might need. We do have several upcoming events here at NACOOE. So coming up next Wednesday, we have our Emergency Preparedness Best Practices webinar, as well as our MMIP, which is Missing and Murdered Indigenous Peoples Compassion Fatigue Training, as well as all of these other future events. And our next Peer-to-Peer Solutions Center HIT event is going to be on August 15th. Coming up, we do have the Infection Prevention and Control Assistance Center. So with this, you can submit IPC cases, share your lessons learned, discuss any questions, ask and access resources. So feel free to visit nacooee.org/projectfirstline or follow that QR code to find out more information. And we are still accepting applications for our Electronic Case Reporting UIO Sub-Grant Award. So this is funding for implementing the electronic case reporting with your UIO's EHR and the CDC. We only have one spot left available, so if you are interested, please fill out that application or email or call Tiffany Stark if you have any questions. And once again, we'd like to remind you to please take our evaluation. We do really appreciate your feedback. We look at it as a way to grow and improve our events and our projects. So any thoughts that you might have had about today's event or any future events, please just let us know. And that wraps up our event today. We will be on for just a moment if you have any other questions or concerns, but we want to thank you all so much for attending and your presence in today's session. And again, thank you, James, for that wonderful presentation. If you need anything else from us, please reach out to us through email. Thank you, everyone.